Welcome to CF Canada's WebEx session on access to medicine. This WebEx session is going to be focused on a new advocacy campaign that CF Canada has embarked on to ensure that people with CF can gain access to a new CF drug called Orkambi. My name is Sarah Blackstock. I am Director of Advocacy and Government Relations at CF Canada, and I'm delighted to be hosting today's session. Today's session is actually a re-recording of a WebEx that we hosted in late April that, due to technical difficulties, could not be posted. Today's session will focus on the advocacy campaign related to this new drug. A second segment will be posted that focuses on that will provide a brief overview of Orkambi, this new CF medication. Today's session really is about access to medicine. It's about ensuring that people with CF have access to the medicine that is best able to help them. Today we're going to be talking about our campaign that's focused on this new CF drug called Orkambi, which is indicated for people with 2 copies of the F508del mutation. Now, whether or not Orkambi is indicated for you or someone you care for, we hope you'll be interested in this campaign, and that's because we know there are several more significant CF drugs in the pipeline. So while this campaign is about Orkambi, it's important to keep in mind that we are approaching it as a campaign that is more fundamentally about access to medicine. What we do now to secure access to Orkambi is going to impact what we do in the future to secure access to other life-changing drugs and treatments. Today's session will focus on what CF Canada is doing and what you can do to ensure affordable, equitable access to Orkambi for those people who have the potential to benefit from this new drug. So what is Orkambi? Orkambi is a combination of the drugs ivacaftor and lumacaftor. As I said, it's a medicine for people with CF with 2 copies of the F508del mutation. The clinical trials that were conducted on Orkambi had modest but encouraging findings. In short, the clinical trials revealed that Orkambi can result in 1. Improved lung function, 2. Fewer lung infection flare-ups, which of course lead to hospitalizations in people with CF in many cases, and 3. Increased body mass index, which is also linked to increased survival. It's important to understand that Orkambi is a preventative drug. It cannot reverse damage to the lungs that has already occurred, and it is a medicine that needs to be taken in addition to a patient's existing treatments and medicines. So like I said, the results of the trial were modest, but certainly significant. And for that reason, it is CF Canada's goal to ensure that those people who have the potential to benefit from this new drug have access to it. So how does a drug make it from the lab to a patient? I am going to provide a very quick overview of what happens here in Canada. When a manufacturer has a new drug, they make a submission to Health Canada. Health Canada then reviews the clinical data and determines if the drug is safe and effective. And if it deems it to be safe and effective, it grants a notice of compliance to the drug developer, and then the product can be prescribed by doctors. It's at this point that some private insurance companies may cover the drug. Orkambi has been approved by Health Canada, and there are a handful of private insurance companies that are currently covering the drug in Canada. But before the drug is covered by our public drug plans, there are more hurdles to cross. And in fact, many private drug plans are also waiting to see what the public drug plans do before making their determinations regarding coverage. In Canada, we have the Common Drug Review. So what happens is that the manufacturer submits the drug to CADTH's Common Drug Review. And the results of that review impact all of the provinces and territories with the exception of Quebec. Quebec has its own evaluation process called INESS. So the Common Drug Review and INESS look at the clinical data and they weigh the benefits of the drug against the price of the drug to determine its value. Essentially, they're asking, is it worth it? Does this drug provide sufficient benefit to justify the cost? Often, it's the case that the CDR will make a recommendation to the provinces that they should indeed cover the drug, but only if particular conditions are met. And one of those conditions is often a reduction in price. Both at the CDR and at INESS, there is an opportunity for patient groups to make a submission, so to ensure that patient voices impact the process. CF Canada has made submissions to the CADTH Common Drug Review and is currently putting together our submission to INESS. Right now, ORCAMBI is with CADTH and INESS. They're looking at the data and determining should the provinces and territories list this drug on their public formulary? Should it be available through the public drug plans? Is it worth it? If the drug is recommended by the Common Drug Review, then it goes to yet another body, and that body is the Pan-Canadian Pharmaceutical Alliance. All of the territories and provinces, as well as the federal government, are now participating in this body. Quebec is also part of this body. And this body negotiates the price. The PCPA sits down with the drug manufacturer and they negotiate the price. Once the negotiations are complete, the provinces and territories make a determination as to whether or not to list the drug, whether or not to make it available to people in their jurisdictions. With ORCAMBI, our goal is to ensure that all of the public and private drug plans cover ORCAMBI, because we believe that everyone in the country, regardless as to where you live, who might be able to benefit from this drug should have access to it. But how do we do that? As many of you will know, in Canada we have 42 CF clinics that are run by highly specialized CF physicians. It's our belief that CF physicians are best placed in collaboration with their patients to determine when to start someone on ORCAMBI and when to stop someone. That is, when to determine if the drug just isn't working. So one of the things that CF Canada is doing right now is working with our CF doctors across Canada to develop recommendations for the clinical criteria for ORCAMBI. And we will be sharing that criteria with the provinces and territories and recommending that that criteria be adopted across the country. What we really want to avoid is a situation where bureaucrats are looking at a budget spreadsheet and making determinations about who should and should not get access to the medicine they need based on a budget line. Our job is to make sure that patient voices are front and center throughout this process. But that is not easy. If we want this drug to be prescribed according to the criteria that CF physicians develop based on the evidence, then we have a number of battles to fight and to win. And from CF Canada's perspective, the only win that is acceptable is a win in which we all win. And by that I mean that everyone who meets the clinical criteria developed by CF Canada's CF specialists gains access to the drug. And the only way we're going to do that is if we work together. So I'd like to take a few minutes to tell you about some of what CF Canada is doing and to offer you some ideas about how you can help. So I've already mentioned that CF Canada is making submissions to the various bodies that will be reviewing this drug. We will also be in touch with our elected and non-elected officials across the country. CF Canada has already written to all of the health ministers in the country to let them know what ORCAMBI is and to tell them a little bit about CF and to tell them about what this drug might mean for people in their province, with 2 copies of the F508 del mutation. Once the CADTH and the NEST evaluations are complete, CF Canada will be seeking meetings with the health ministers and health critics. And at these meetings, we will ensure that there are voices from people with CF. We will also be calling on the expertise of CF physicians so that our decision makers can trust that the perspectives, advice, and analysis of CF Canada is based on evidence and based on the insight and experience of people living with this disease. CF Canada will also be engaging in a public campaign through our website and social media. In the next few months, we will be focused on building awareness of and support for the principle of access to medicine. And we'll also be building awareness of lumacaftor ivacaftor, or CANBI. We'll do that with resources on our website, share graphics that will be shared through social media, a video that will also be shared on social media, and blogs that will be written from people in the CF community. I'd like now to take a few minutes to share some ideas about things that you can do in this campaign. As I said, CF Canada will be meeting with ministers of health, health critics, and other elected officials across the country. We are also asking people in the CF community to meet with your MPP or MLA, and CF Canada can provide support and resource for these meetings. We have backgrounders, we have information on how to set up a meeting, we have data and information about the new drug that will be very useful to meetings with MLAs and MPPs, and these resources are available on our website. Additionally, in British Columbia and in Alberta, we have terrific advocates, lead advocates, who can provide some support, and they'll be assisting with some of the coordinating of these meetings. Many of you will know Chris Black out in British Columbia. In Alberta, we have a very committed advocate named Paul Price. If you are from BC or Alberta and don't know Chris or Paul, you can be in touch with me and I will connect you. So I think I mentioned that I'm going to give you a list of 5 things that you can do to help. The first one is meet with your MPP or MLA. If you are willing to set up a meeting with your MPP or MLA, we do ask that you be in touch with me so that I can provide you with support and resources, and so that CF Canada can track the meetings and the outcomes of those meetings. My email address is now on the screen. As is clear, the work and the process of getting a drug approved is often long, complex, and bureaucratic. Much of that complexity and bureaucracy is important to determining a drug's safety, efficacy, and value. But for people with rare diseases, there's also an additional hurdle, and that's that decision makers are also grappling with the cost of expensive drugs. And certainly for people with rare diseases, it's often the case that the drugs that we need access to are quite expensive. So in addition to navigating the various layers of the evaluation process and weighing the benefit of the drugs, we can appreciate that decision makers might lose sight of the people whose lives are impacted and often dramatically changed by these new medicines. As advocates, as people with CF, as caregivers, as allies, our job is to keep people with CF at the center of discussions and decision-making processes about new drugs. And one way we do that is by sharing our stories and perspectives in an honest and respectful manner. There are many ways to tell our stories and share our opinions. Number 2 on that list of things you can do to participate in this campaign is to write a letter to your MPP or MLA, as well as the health minister and the health critics in your jurisdiction. We ask that you consider writing a letter that explains why you think Orkambi should be covered by the public drug plan. Share your experiences of living with CF or caring for someone with CF. Share your hopes for the impact that the drug might have on your life or the life of your loved one. On the CF website, there are resources that can help you craft the letter, including a backgrounder on Orkambi. But we do ask that you not lose sight of the importance of your story. We also ask that you copy me, Sarah Blackstock, on your letters so that, again, CF Canada can track them and monitor the responses that we're getting from elected people across the country. Number 3 on the list of 5 things you can do to help is to write a blog for CF Canada about why you think securing access to Orkambi is important. What are the ideas that you have about why this drug is important, about how the decisions should be made? CF Canada can give you tips about the kind of short, personal, compelling blogs we're looking for. Number 4 on the list is to write an opinion piece for your local newspaper. Assuming there's a positive decision from the CDR, that might be a good time to write a letter about why you think the provinces and territories should work quickly with the company to negotiate a fair price for this important new drug. We are expecting the CADTH recommendation at the end of June and the recommendation from NS at the end of October. It's going to be important that the voices of people with CF and voices of friends and family are loud and clear. We need to ensure that our decision makers, our elected decision makers, and the companies sit down in good faith to get the negotiations done in an efficient manner so that people who can potentially benefit from this drug get access to it. If you are interested in writing a blog or an opinion piece, please email me and I can provide you with some support. And again, there's my email address. 5th on the list of things you can do to help is to get social. CF Canada will be sharing updates, resources, and graphics over the coming months on our social platforms. We'll be also sharing a short video in a couple of months. These small bite-sized nuggets will be designed to capture key messages that will inform and inspire the public and that will be designed to capture key messages that will inform and inspire the public and decision makers about the importance of access to medicine for people with CF. Later in the campaign, once a decision has been made by the Common Drug Review and NS, CF Canada will launch a more direct social strategy focused on our provincial and territorial health ministers. So please do stay in touch with us. Let me just recap what you can do. Meet with your MPP or MLA. Tell them your story. Tell them what it's like to live with CF. Tell them why access to medicine is important to you. Please consider writing to your MPP or MLA, in addition to the health minister and health critics. Consider writing a blog for CF Canada. Please also consider writing an opinion piece for your local newspaper, and please also participate in our social campaigns. And as you do these things, please let CF Canada know by emailing advocacy@cysticfibrosis.ca. We hope you'll find the resources and updates that will be available on our website and on our social platforms useful. The CF community is a very small one, but throughout the history of CF Canada, it's been very clear that while we are a small community, we are a mighty community, and one that is very determined and can have great impact. CF Canada is looking forward to working with all of you to ensure that people with CF gain access to the medicine that they need based on the principles of affordability and equitable access. We all benefit. We're all concerned about sustaining our public health care system and our public drug plans. Guided by the principles of accessibility and equity, we're sure that we can ensure that people with CF have the medicine they need and a strong, reliable healthcare system. Thank you very much for your attention and your interest in this campaign.